Attention women's health professionals, the next round of FAMM is just around the corner. Classes start on October 4th. FAMM is the perfect program for busy women's health professionals who want to offer fertility awareness charting support in their practice. FAMM cuts out all the fluff and only focuses on what you need to serve your clients better. Each module, homework assignment, in-class training, and chart review session is there for a reason. Where will you be 9 months from now? With a FAMM certification, you'll have a brand new skill set that will allow you to use the menstrual cycle as a diagnostic tool and vital sign in your practice. Your confidence in analyzing and interpreting menstrual cycle charts will be at a level you can't even imagine today. And you'll have a brand new offering in your business that will allow you to reach more clients. This knowledge is truly life-changing. Transform your practice in 9 months. You won't regret it. Join us this October in FAMM. Head over to fertilityfriday.com/FAMMlive to apply today. That's fertilityfriday.com/FAMMLIVE. This is the Fertility Friday podcast, episode number 485. Today I'm sharing a brand new episode in my FAMM Practitioner series. I'm sharing my interview with Samantha Avnet. And we talk a lot about period pain, what's normal, what's not. And Samantha shares her personal experience with debilitating period pain and what she had to do to eventually overcome it. Before we jump into today's episode, I want to share a little bit about Samantha. She is a nationally board certified and California licensed acupuncturist and herbalist, and also a certified Arvigo abdominal therapy practitioner. She has been working with plant medicine for over 20 years, with her roots in herbal traditions, and is a certified women's herbal educator with her expertise in gynecological and menstrual health concerns. Samantha began her journey as a healthcare provider when she was a teenager in the 90s after her own struggles with debilitating menstrual cramps and physical sensations associated with anxiety. Her private practice is dedicated and passionate about bringing quality, holistic healthcare to the community with a focus on supporting mental and emotional health and the menstrual cycle. So without further ado, let's go ahead and jump into today's episode. Well, and I'm excited to be here today with Samantha Avnet. Welcome to the show, Samantha.
Thanks, Lisa. It's so fun to be here. Thank you for having me.
Well, thank you so much for coming on the show. I was telling you before, and I feel like I'm a broken record here, but I really love doing these episodes because they're real. I love sharing the real stories of women and practitioners and clients because I feel like that's what's really going on, right? And that's what we're doing with the FAMM program as well. We're helping real women deal with these very real challenges in their menstrual cycles. So with that in mind, I'd love to give you an opportunity to share a little bit about yourself. One of my favorite questions to ask, as you probably know, in these interviews is, what were your cycles like? If you want to share with us, menarche, and kind of take us through the journey of what led you to do what you're doing now. So share a little bit about your profession and also what led you to jump into the FAMM program at this point.
Yeah, menarche. I am definitely one of these people that have had painful periods straight from menarche. I was throwing up, just really bad cramps, passing out. And I was put on some pharmaceutical grade painkillers. And it was my mom also had really bad periods. So it was kind of just like how everybody else learns, oh, this is just what it is. As I got older, starting in my later teens, my mom said something it's genetic. This is just how it is, just kind of, but being an older teenager versus younger, I was no, this isn't feel right. I don't feel like this is how it's supposed to be. And I felt also the pain relievers, they were also hurting my stomach. So then it was I'd have this stomach pain and then the cramps, and I'm just no, there's got to be another way. And I'd say that at that point, I was probably 17, probably 18. And I was living in Santa Cruz at the time. I was going to start college, and somebody that I was living with handed me an herb book. And then it kind of just, my whole world just was whoa, just kind of opened up. And luckily I was living there. There was an herb store. I mean, I was really fortunate. There was Yeah. So I was learning about herbs. And then I still didn't fully know the nutrition part of the thing. And so I think that was like another part of it where I remember I was like eating, like starting to get really like into these like instant made cakes that you kind of like with the instant you just add a like milk or water to the batter, and they were so good. And I was like eating them all the time. I was like, these are so good. But then I started feeling in my body, I started getting like angry, like really angry about things, like just really like on edge. And I'm like, what is going on with me? And then I just made that connection. I was like, oh my God, it's the cakes. And then, yeah, then that was like, that I started going to the health food store. I mean, like that was a whole other piece to it. Yeah. And then I started just like my herbal medicine, like the whole journey of being an herbalist and learning about herbs, going to like a decade worth of Northern California women's herbal symposiums, like 5 years of American Herbalist Guilds, like studying with amazing herbalists. Yeah, in my 20s, apprenticing with an herbalist in Ireland for like 2 springs. And yeah, it changed me. And I'd say around that time as a late teen, because I started getting really into all of this stuff, anything about how our bodies worked, that's when taking charge of your fertility came into my life, because I was like, oh my God, what is this? And I just even remember seeing the pictures at the ferning of ovulation in that book. And I was like, are you kidding me? Like, we are amazing. So that was kind of my introduction to fertility awareness. But I had no idea it was like a whole thing. Like you could be an educator. I mean, that's like, I had no idea. So yeah, so I'd say then my 20s and then late 20s, I had the most amazing experience of receiving our Vigo abdominal therapy. And that was the next tier of like, that was it. It changed so much. I mean, I know I just said all those things change things, but they did, but there's just been these tiers. So yeah, I took training right away. And I'd say around that time, I was wanting a career enhancement because as an herbalist, at least in this country, it's not, I mean, I know people can make a living, but I felt like I needed more and I wanted more supervision. And I was even looking into like medical schools because I was almost like, do I want to be like OBGYN? How do I work with women even more intensely? Do I want to be a naturopath? You know, all these things. Anyways, long story short, I started taking pre-med and then, yeah, decided on acupuncture school because it just kind of aligned with what I'd been doing for so long already. And as so many, like how you've interviewed people, just like TCM or Chinese medicine has like gynecology down. I mean, it is like so rich in treating gynecological conditions. So I was like, okay. And so I did that, finished my Arvigo trainings, and that's my practice basically. I'm doing herbal medicine, Arvigo, acupuncture. I really do a lot of mindset stuff. I, got into meditation in my 20s as well, because I also experience anxiety and stuff like that. So my practice is very big on mindset, nutrition, and just like gynecological health. So there's so much more, but I think that you got the gist. And say to this day, yeah, my periods got so much better. And I don't know if I had endo, like I didn't get a laparoscopy. And I think my acupuncturist at the time in my 20s was like, look at, whether you are diagnosed or not, I'm going to be treating you the same way. And she's like, I'm not saying that you don't need to get diagnosed, but just know that. And it really like landed for me, at least at that age and that time. So yeah, here I am. And my periods have definitely gotten better. And now I'm entering perimenopause. So that's a whole other thing. But I feel like I'm doing pretty well.
Well, thank you so much for taking us through.
Yeah.
I love that. I always find it fascinating. We just went through like 20 years of your life or more. So just like that, just like a quick
Yeah,
play, right?
yeah.
But it's really fascinating to discover the different routes we take to kind of get to what we're doing. And You did say this, I think, in the pre-chat, which is that, or something like this, which is that we do kind of find our way often into these helping professions, particularly women's health, because of our own challenges. Like the challenges that we go through improving our own cycles is often what inspires us to then seek out routes to help other women in similar circumstances. So I feel like that's really like full circle kind of the situation
Yeah.
for yourself. And then in terms of the FAMM program, so it's interesting, you discovered fertility awareness in your 20s. So similar to me with taking charge of your fertility. And it's just like such an, it's obviously a rabbit hole, like I'm still down there.
Mm-hmm.
And what
Mm-hmm.
prompted you to kind of jump into like the FAMM stuff? I think you probably hinted at it, which is like, I didn't know you could actually like make this a thing.
Yeah. Yeah. So I think because I've been so focused on the period, like the bleeding part, which obviously happens because of the ovulatory part. But like I said, I really didn't know that you could go down the rabbit hole in the ovulatory way, like how I did like the period way, the menses way. And I think that I heard your name before, I think through some Arvigo stuff, but it wasn't until I listened to, yeah, Aviva Ram was having her like book launch, and you were one of the guests on there. And I was like, what? So I like promptly listened to your book on audio, and I was like, oh my gosh. And then I was like, found your podcast, and I was like, wait, you've like interviewed Rosita? Like if you've interviewed these people, and I was like, this person, I need to just like be in this person's world. And then I just started listening. I was like, oh my gosh, there's so much more I can be helping my patients with. And I think like even though in TCM we do use BBT and we do use charting, it's just different. I wanted to educate more, and like certain questions that would come my way, I couldn't fully answer in a way that I felt, I guess, embodied maybe because I read it in a book. And I really, it's fine that I read the book, but I really need to like learn and really just do it. And so it kind of was like, okay, this is the cherry on top of how I am showing up for my patients and able to help them. And I think especially now with so much femtech, people are wearing Oura rings or whatever, and whatever people think about different ways that BBT and if it's right or not, whichever, this is still empowering for a lot of people that are like, oh, my temperature shifts like during, and during the months. And so I can just be a better resource for them. And so, yeah, that's why I decided to take it. It's just like really all just like to help people and help my patients and be an important, reliable resource. And this information is just so important and critical. And I think especially with so much of the hormone testing that's happening these days, and we've talked about that, and how that when people are getting a hormone testing, they're not like, they're told what day to get it on, but like even if you might have a regular cycle, you totally could be ovulating at different times. And so that date that you're getting a hormone testing, it may not be accurate for what you need, and you've just spent all this money. And I don't know. So I think just being able to share this education feels really important to me.
Mm-hmm. Well, that's so interesting. It's always fascinating to kind of find out how it all kind of transpired. And it's so interesting because I mean, it shows you, I mean, there's no one modality that can possibly like fertility awareness as the menstrual cycle is a vital sign piece of it, like included. Like there's no one modality that can do all of the things. And so what I love about kind of your journey is how you've kind of, like you said, like at every stage, there was like deepening into it, like, okay, and then there's more. And then I kind of master this level. Okay. And then there's more. And so it's really just, if you think about all of the time and energy and money that you've put into where you are today in terms of your knowledge and your ability to support clients through a variety of different modalities, I mean, that is a game changer because and that's the whole point, right? Mm-hmm. The whole point is to be able to serve the whole person and to be able to find ways to really help. And there's so much of what you were sharing in your story. I was taking notes in the background, but I mean, it's just even your own journey with your periods. You shared, I feel like, your experience with your mom. And I mean, let's talk about that because I mean, she had painful periods. And so she was kind of like, it's just genetic, right? It's just how it's going to be. And it would be interesting to find out, like, well, who told you that? Like, right? To just expect that this is like, we are the Avnets and this is just our lot in life, right? How many women feel the same? How many of your patients over the years? And we've talked about this in class where I have a specific place in my intake form, and I know you do as well, where you have to dial it down and ask all of these specific questions about the period, because so many women have experienced the pain for so long that unless you do that, it's just part of it's literally just part of their identity. They won't even tell you. It's not even why they're there. And it could be this horrific pain that's really interfering with their life.
Yeah. So wait, what was the question?
I was thinking about that after I asked it, where I ended up meandering, and I was like, what is the question? But if you could just share a little bit about your experience of that kind of
narrative,
like that kind of idea, similar to what your mom had said, where this is just natural and we just have to deal with it.
Yeah. I mean, I think it's also complex because I also don't like the narrative. This is personally that we also don't have to experience any pain ever. And sure, I have patients that have never had cramps, sure. But I also feel like when I work with my patients, it's like I also don't want it to also be that narrative of like the only way for a healthy period is to have zero cramps. So I guess that's not really talking about what you asked, but I feel like it's just on the other side. But yes,
we could explore that, because I feel like that's an interesting topic as well. I mean, the fact is that a huge percentage of women do experience pain. And I'm one of them, and you're one of them. And so what's interesting, coming from the perspective of someone who has experienced pain, a lot of it, I feel like my narrative wouldn't necessarily be like, and there should never be any sensation whatsoever. And I feel like my narrative is typically, or I don't know if narrative is the right word, but typically the way I think about it is that mild to moderate, not needing heavy pain meds to survive.
Yes. And I think I was speaking to the certain things I've been hearing, certain teachers or certain, where, and it can feel not helpful for a lot of women, because maybe they have actually done a lot of work and they have gotten their pain down to a significant level, like a 3 instead of an 8 or whatever. And if there's still this, like, it's still unhealthy because there's some pain, like you're not, like I've heard people say, like, you're not supposed to experience pain. And sure, I know that there are people that don't, but I think that it's also okay to experience some, right, that's not interrupting quality of life, right, that you're not having to take a ton of painkillers and all the time, and that they feel manageable. So I don't know if that's going to be controversial, but I wanted to say on the other side, but yes, I feel like there is the narrative that periods have to, like, they are painful, like bad painful, and that's just the way it is, and we're just supposed to take painkillers and this and this and this and this. And and yeah, it's like even patients will be like, oh yeah, they're not that bad, maybe we do the pain scale, they're like a 6, 7 out of 10. And you're like, okay, like, they're like, well, my friend gets them this way, and I'm like, okay, and like we can totally get that down, like, and like, let's just keep, it doesn't have to be that. And it's kind of like, wait, what? Because yeah, a lot of women, we are just living with a lot of pain and pushing through it because we're just told that that's what it is. That's what a period is. And we just have to deal with it.
Well, and so I feel like I'm getting where you're coming from with this. So I have a question about that, which is, like, is the issue the unrealistic expectation that it sets up for certain clients of yours? I would imagine as an acupuncturist and an herbalist, you're having, especially with a particular interest in menstrual cycle health, right? And
Mm-hmm.
also with your Arvigo.
Mm-hmm.
So you're working with what I would imagine, so correct me if I'm wrong, that you're working with quite a few women that actually
Mm-hmm.
do have this issue of painful periods. So is it that it sets up this because I would agree, like like if
Yeah.
someone has this history of severe pain,
Mm-hmm.
they're much more likely to have endo or
Mm-hmm.
another, pelvic inflammatory issue. And so for those women, setting the expectation that they're to have no pain ever, that's not realistic, right? So is
Mm-hmm.
it kind of like that where you end up
Yeah.
having all these clients who are just feeling like a failure date, like cycle after cycle because it's not at zero yet?
I mean, not to that degree, but yes, you're correct. I think that women that are experiencing very severe periods, I think it can be unrealistic at times to be like, okay, and like you're just never gonna feel pain, which I mean it can happen. It can happen. I guess I'm just speaking to the narrative that I hear, that I feel like it was important to speak about that periods are not supposed to be painful at all. And I think that while that can be true, I think for that people who have suffered for so long, that like maybe they're like a 2 out of 10 is totally okay, after coming from 11 out of 10 every month and throwing up, and a 2 out of 10 and maybe only needing like one to leave, and they can still do all the things, they can still take care of themselves, do or whatever it is. But I think it can feel really overwhelming.
Mm-hmm. Well, I mean, I feel like this is such an interesting conversation. And I feel like if I were to throw in my take on it, I would, what I always aim for is an understanding and awareness. And I think that I always kind of go back to like common but not normal, not optimal.
Yeah.
And I would be happier if more women just knew that, okay, if it's that bad, it's not normal.
Yeah.
And when you're working individually with clients, we're looking for improvements. And so that's
Exactly.
something where we've talked a lot about. You're not comparing yourself with some random person that you've never met on the
Yeah.
internet. Like you're comparing yourself to yourself. You're
Yeah.
comparing yourself 6 months ago to
Exactly.
yourself now, right? And we're looking for improvements and
Mm-hmm.
all of those
Yeah.
things. But I feel like the lovely takeaway that I always hope that people take from enjoying my work, whether it's the podcast or the book or
Mm-hmm.
whatever, is that, yeah, a lot of women have painful periods, but no, like that's not optimal. And when it's painful, it
Yeah.
means that there's something wrong.
Yeah.
And I would hope, because I think that that's an important point to put out there, that it's not to try to then make another unrealistic expectation that no one should ever feel any pain or whatever, but you should be aware that if your periods are so painful and you work so hard to get them to a 2, we should be aware that there's an underlying reason why it's that way. It's not just you and like your poor genetics, right? Like I feel like
Mm-hmm.
we should be aware that there's probably a reason
Mm-hmm.
why it's like that. I mean, I don't know if how, like I phrase things differently because I'm looking at things from a different lens.
Mm-hmm.
And I think we're both passionate about it because we don't want women to be in pain.
Yeah.
We don't want them to not know that there's something wrong. And then we don't
Mm-hmm.
want them to like see great improvements and still feel bad about it.
Mm-hmm. Yeah, no, for sure. I mean, obviously, I try to work with a team, like refer out as needed if they don't already have an OBGYN or whatever, an ND. So, I think that stuff is very important. But I really work with women because they come in often. So we are actually able to like every time they have a cycle, like every month, or what if it is every month, we can go through the pain scale. And even if it's like dropped one thing down and one number down, and they were able to take one less, and you're able to actually like reflect that back to them. Because like I know the pain scales, they can be really annoying in here for sure. And I try to explain that it's really, because even though it's really hard sometimes to quantify it, and that really I see over time it really is helpful, because they're like, oh, I am like, okay, that I guess that was better. And
Yeah.
that can also make a huge difference in their mood, and just the way that they are taking care of themselves. Like, okay, this is working, like this is helping, like I am doing the things. So yeah.
Well, so for the women who are listening, because period pain is going to find its way somehow into the title of today's show, right? So if they're choosing this episode for that, you've been in this field for a long time, and you have not only your personal experience improving your pain significantly, but you have the professional experience of supporting women through this as well with a variety of modalities also. And so just based on your experience, share a little bit about what have you seen to be the factors that contribute to this? And do you have a couple of, I know it's different for different people, but are there a couple of things that really stand out, like that you see drastic improvements for a lot, not everybody, obviously, but a lot of people?
Yeah, I think that it varies. And I mean, I think especially because I do Chinese medicine, and then just my background with household trauma, all these different things, that I cannot overlook the psycho-emotional piece in a lot of this pain. And I'm not saying it's the only reason, but sure, we could do diet and herbs and acupuncture and a lot of times, if not all the time, there is a psycho-emotional piece. Like at one point, I thought I was even going to start moving away from women's health and just focus on mental health. And then I realized, wait, no, it's the same thing. It's literally the same thing. And so I think that's why I love doing acupuncture, because it really helps settle the nervous system. Like, most people in here will fall asleep, or if they don't, they feel different afterwards. And it's like, if we can get our nervous system to a place of just safety and calm, a lot of times, like hormone, immunity, all these other things will fall into place. And I think that's also why I love the Arvigo. And there's so many pieces, but the strokes are so slow. It's so calming to the nervous system. And it's just like a huge part of it. So, I mean, it's more than just the physical part. Sure, you are going into the tissue and all these things, but there is this safety piece. But that's how my practice is focused. So I would say there's that piece I feel like can really be looked over a lot. And, I make sure that most people, if they don't have a therapist, if they need referrals for counselors or groups or whatever, that people are, or a journal, all the things that they're able to kind of go through this stuff. So sure, there's all those other parts too, like diet, sleep, all the foundational factors, sure. But the psycho-emotional piece is it's huge. It's huge. And I know it was one that was overlooked for me. And and then it's the genetics, and then the epigenetic, how long, it's like, am I the first woman in my family to really deal with this? And my mom had it, my grandma had it, how far back does this go? And so yeah, I would say that's a huge factor. At least what I see in here, at least the patients that I attract. But of course, it's not always the case, but I'd say that majority, there's a lot of underlying components there.
As a women's health professional, you already know the value of tracking the menstrual cycle, but I'm guessing that you're not comfortable interpreting complex charts, weird mucus patterns, abnormal bleeding, or other similar situations. You're passionate about fertility awareness and want to use it in your practice, but you're just not sure where to start. That's where FAMM comes in. The next class of FAMM is just around the corner. Registration is now open for the Fertility Awareness Mastery Mentorship Program. Classes start on October 4th. By the time you finish your FAMM certification, you'll have the skills to confidently teach fertility awareness to your clients, interpret all kinds of complex charting scenarios, and you'll have the step-by-step protocols you need to help your clients improve their hormone and menstrual cycle health. Apply today at fertilityfriday.com/FAMMlive. And when you apply, we'll send you the details to join one of our upcoming information sessions. Transform your practice in 9 months. Head over to fertilityfriday.com/FAMMlive. That's fertilityfriday.com/FAMMlive. Now let's go ahead and jump back into today's episode. Well, I think one of the things that I love about the abdominal therapy modalities, like Arvigo and like Mercier, right? And I've interviewed a number of people from these various abdominal therapy modalities over the years, is that, again, it takes us into the physicality of our bodies, because we certainly live in a world now where we are looking at diet and supplementation. And obviously, that's all fair game. It's a part of the FAMM program, right? But when it comes to period pain, there's often a physical piece of that, whether it's endometriotic lesions or adhesions, or which limit the mobility of the uterus. And I find that with reproductive health, we're often very detached from our physical bodies. Maybe that's one of the reasons that I appreciate FAMM, like the fertility awareness method and charting, because it brings you into contact with your fluids, and for women who are comfortable checking their cervical, but like it makes it not just numbers on a test lab or a lab test or something. Like, it makes it such that this is what's going on in your physical body. And it shows you even how physically manipulating that area can make a difference in your body, and making certain changes can make a difference in your cycle, I think. Yeah. So I'm not sure if that's a big piece of it for you, but given that given that you do body work and you see, like, it blows the mind if you think about it, for someone who's spent a lifetime taking a variety of different medications, that doing abdominal therapy work, doing physical work on the body, like you said, calming the body, relaxing the body, but also physically working on that area can yield such significant results for women who've struggled with these types of issues for years.
Yeah, no, it's huge. That physical piece is a lot of times also a missing component. I feel like it really brings it all together. And I think also what I love about the Arvigo work is that you teach the self-care abdominal therapy after their first session. So they get to leave with this technique, and they do it on themselves. We teach pelvic steams, we teach castor oil packs. So again, like 2 other modalities that are incredibly nourishing to the body and connecting to the body, and provide a deep sense of relaxation, while all at the same time being so incredibly powerful. And I think that's another thing, is like, maybe we don't need to have, like, sometimes people are like, they want me to go deeper sometimes with that Arvigo. And in a way, it's like, it's amazing that how much can happen when the nervous system, when you're feeling safe and nourished, like, especially in the abdominal region. And so, I think all of those things, all those components, those physical pieces are huge, because like you said, it also connects you to your body. And most people feel really relaxed in the report when they come back. I did the castor packs. I felt like really relaxed, or I love the pelvic steam, or people get sort of nervous when they first come in here. They don't know what to expect. And then afterwards, they're just like in a daze. They're just like, that was so relaxing. And I think that's just, it's super important that deep work can happen, but it doesn't also have to be painful.
Mm-hmm. Well, I'm thinking about women who've had extreme pain, and my pain, I rate pretty high in my 20s and things. However, like most women, I know that plenty of women had it worse than me, right? Like, we're all there. But the point of that is that I've interviewed a number of women with really severe endo, like the kind of unimaginable, similar to how you described actually in your teenage years, where vomiting and passing out and being just, that's super traumatic. And so then the anxiety that would come on naturally every time your period's about to start. So I guess I do have a question out of that, which is, you mentioned the emotional aspect of it, and that I would imagine would be a big one. Plenty of women in that type of situation would have legitimately developed some degree of PTSD, right? Because every time their period's about to start, it's just like, how bad is this going to be? But then my question out of that is, were you also referring to kind of past trauma? Because, and not for everybody, but for some women, there is a link between some of this really, really hard period pain and things like that with past trauma.
Yeah, I mean, definitely. I just think of just Chinese medicine, even, or probably a lot of traditional medicines. I mean, when there's trauma, or when there's this tightening, things get congested, things can't move, like blood flow, all this stuff, things aren't working properly, and we need flow. And then there's that whole, saying the issues are in our tissues, that whole thing. So it's like, I'm a really big believer in all that, because from my personal experience and what I see and hear, and people have emotional release, all the things. And then it's like, even when they have an emotional release, I mean, not everybody does, but I can actually go in a little bit deeper. Like literally, it's like this cave just opened up. You're
that's
like,
so interesting.
Yeah. So yes, trauma, anything that's going to cause like a shock to the heart, it's gonna probably have a ripple effect to the uterus.
Mm-hmm. Oh, that's so fascinating. I mean, it's such the period pain aspect of it, it's certainly multifaceted. And I remember being frustrated as a teenager when people would just say these things. Like I remember reading this book, because this is what came to mind, but I remember reading this book, and this woman, I probably said this on the podcast before, she was talking about how like she had some sort of emotional thing in her past, and she had like a significant like emotional release, and then she was like, and then I never had pain again. And I remember thinking like, what? Like 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 that's good for you, but like right.
Right,
So
right. And right. Exactly.
and then, but not just that. So I also remember there was always somewhere like where, like, as I read a lot, obviously, because I'm a bit of a nerd over here, but it was always like, oh, and I just took cramp bark and it was fine. And oh, I just did this and it was fine. Oh, I just took magnesium, it was fine. No, there was always this idea that there's just going to be this one magical thing that you're just going to do or take or whatever. And then it's going to be all good after that. And so as somebody who actually had really ridiculous. So for anyone hasn't heard all my pain stories, when I went into labor with my eldest son, I like literally was like having contractions all day, and I had no idea that they were contractions. I was like, this must be Braxton Hicks. Because my period, like this can't be labor, obviously, because my period pain is worse. But anyways, that's the level we're talking about here.
Yes.
But the reason I share that is because I remember feeling so frustrated with all of those kinds of things, where it was kind of like everyone, or not everyone, but it felt like it at the time, right? All of these resources were kind of indicating that it's just so easy. You just have to find this thing and then you'll never have pain again. And maybe that's even what you were getting at. If you've been there and done that, or if you work with clients who experience period pain, it's not like that. For women who experience this like chronic, moderate to severe pain, it's like a chronic condition, and you find a way to manage it. And so some women are able to get to the point where they just have no pain at all. But I think a lot of women get to the point where they've brought it down significantly, like myself included. And if they have a really crazy, stressful, terrible eating a month or whatever, then it can kick up a little bit. And then, so you're managing it. It's like there's a bear in the corner, and as long as you like feed it and water it or whatever, it's like usually okay. But if you forget about it, sometimes it starts to growl, and then you're like, okay, yeah, I'll give you some food. Like, right? I don't know if you resonate with that analogy, but like that's been my experience of what this really looks like. And there's a lot of different things that you often have to do to get there. It's not like it's one magical thing.
Yes, 100%. I mean, and again, right, there are those people, like you said, can have an emotional release. They don't have pain anymore. Or maybe they do take the cramp bark and they're fine, but yes, that's not sure, but it can be very multifaceted for a lot of people. And I think that for me, it is important to have this toolbox that I come from. And I'm also refer out all the time. Like I refer to pelvic PT, I refer to chiropractors. I mean, often it can take a team first to really get you to where you need to be. And I have a lot of different herbs we can try. Like it's kind of like medication. Maybe you need to try certain things before you get to the right one. And yes, it's definitely multifaceted, and it is hard. When people are like, oh yeah, just take magnesium. And it's like, sure, for some people that might be the magic thing. Like you're just like, oh my God, I'm like, oh my God, that worked for you. That's amazing. I mean, that's how I feel about acupuncture a lot. I'm like, that worked, but I think because of my experience, it helps me to understand other complex experiences. I'm not like, oh, that's weird that formula and then the supplement is not working. There's so many things. And And like I said, it can be simple for some people, but for a majority, it can be very complex. And right, it can shift month to month. And yes, even though my period pain is so much better, I mean, it's not like I'm all gone, but it's like to the place where it's like, oh my God, it's so good. I'm just like, I will take this, and it's low. So yeah, I think it is important to really listen to where your patients or your clients are, and they've told you they've tried all the things. Maybe like so many people like, I went to this ND and I had like 15 supplements, which is fine. I send people to NDs. And so I'm not going to be like, okay, well, just like maybe try magnesium again. It's like, okay, like let's.
You just didn't take it right the first time.
Yeah, I think it is just important, to really listen and hear these stories of all the things that people have gone through, all these, like what women have gone through and what it is that they really need from you, from what you can offer. We all have our wheelhouse. And sometimes people come to me looking for more stuff, and that's when I refer out, because it's like, okay, like I need to consolidate here, like my wheelhouse. These are the things that I can help to support you. And that's like what we can do in here. For more stuff, like, okay, like if it's really, really diet stuff, like, hey, a nutritionist and this and functional medicine, it's just like, it's important for me also to just focus on what I can offer.
Mm-hmm. Yeah, no, I love that. And just, I feel like this conversation is so rich because it really does reflect the challenge. I've had clients who, and we're not knocking magnesium. Magnesium is an important part of the inflammatory process. We're not knocking any of it. We're not knocking cramp bark. But what it really highlights, and similar to like kind of if we like the FAMM process, where everybody is not the same. And so you can have two people who even present with a very similar kind of situation, but what works well for the one person may just not be enough for the other person. And I think that's often the piece of this conversation of period pain that is missing. And it's hard to have that nuance in a social media post or something like that, right? But in real life, yeah, there's a lot of individual differences. And it's just like you said, you need often a team approach, different modalities, and really working towards what helps this actual individual, what actually moves the needle, what actually results in a reduction for them, and listening to your patient and not being all like, well, why, like, I've got the protocol, like, what do we need? Like, it's not about that. It's about what actually moves the needle for that person. So as we kind of start wrapping up today, I would love to just ask you a couple of questions about your experience in FAMM, because obviously you came to the program, well educated and experienced, right, in your respective modalities. And you talked a little bit about what you were looking for in terms of being able to better serve your clients. So for someone who's listening kind of for that purpose and thinking, well, I wonder if this would be useful in my practice, what would you want them to know? Like maybe share with us a little bit about what are you able to do now with clients that you weren't able to do before?
Yeah, I mean, I think I mentioned this earlier, but I'm just able to really show up in a different way when people are presenting their charts to me, especially new patients that I didn't even know that they were charting, a bit again, especially, I mean, I live in San Francisco. It's like the tech capital of the world. Like there's a lot of the Aura rings and the devices and the watches and everyone's, and which is fine. And so it's kind of cool actually to see, what it's doing. And I'm able to better assist them with, okay, like mucus. And so you're doing it, like, this is great to see the BBT and all these things, but let's really get into the mucus piece. And yeah, so I guess it's just really helping me to better show up for patients when they have questions or if they're doing these things. And I feel like before, I mean, again, I was doing BBT and a little bit of mucus, but I just know a lot more now. I'm just like better able to educate. I think because it's, like I said, sure, you could read your book and all these things which I had, but for me, it feels different actually having gone through the program, looking at the charts, hearing what you're saying, of course, doing my own chart, having just like the Slack channel, and we're all like asking like all the time, like just questions about charting, and just it's more confidence in that realm. Like I'm able to answer from a place of knowing versus just reading, which is fine too. But for me, I need to do the thing to be able to offer the thing.
That makes sense. Yeah. It's hard to, well, I think that makes sense with for anything where if you're really wanting to support your clients in this way, it's more helpful to actually know how to do it than and have had the experience of doing it yourself as well. Well, and I suppose one last question is for someone who's listening who is thinking about it, like, what would you say to the practitioner who's like, should I try? Should I not try? What would you say to that person?
I would say that if you've been on the fence and you're been wanting to dive deep into this stuff, I mean, I think this is invaluable depending on what your practice is based on. I mean, it's like you're getting gold worth of information and support. I think that if you have any excitement at all about it, then I think that doing it, because there's probably nothing else like it. And it's really important for me to learn from people that have clinical experience. Lisa has so much experience, and you're going to just learn so much. And I guess that's what I have to say.
Oh, thank you so much. That's so sweet. Well, and so you mentioned that you live in the Bay Area. So share a little bit about your your practice, and give us all the details, like your email, or not your email, your website, if you have the socials, and if you have anything exciting happening these days.
So I'm in San Francisco, and my practice, like I said, it's very much just focus on acupuncture, herbal medicine, Arvigo, and really getting to root cause stuff, so all of the intakes are really, really thorough, and just try to get you the best care possible. As an acupuncturist, this is rare, but I treat only one patient at a time. So I do not leave, I don't have multiple rooms. So you get really good care in here. I mean, not that the other way is not, but for a lot of mental health stuff, I can be in here longer with people. And so that's different. I also can combine the Arvigo and the acupuncture. So that's pretty cool stuff. And so I have a website. My business name is Poppyfield Wellness, and it's just poppyfieldwellness.com. I don't have any socials, but you should find everything that you need on the website, all my contact information, including email, and there's Google reviews and Yelp reviews. I don't know, but anyone is welcome to reach out to me to ask any questions or anything. Yeah.
Awesome. Well, thank you for sharing all of that. For anyone who's on the go, you don't have to worry about remembering all those details. We will have all of your links in the show notes page for today's episode. And I want to thank you for jumping on the show. At the time that we're recording this, we have spent it's towards the end of the program. I feel like this is 8 months we spent together. We've been together for quite some time. We've got to know each other really well. And I'm really excited for you and what you're able to incorporate into your practice, having come out, the other end of this program. So thank you so much for being here today, Samantha.
Oh, thank you for having me. It's great to talk.
Thank you for listening. If you enjoyed today's show, please share it with a friend. You'll find the show notes page for today's episode over at fertilityfriday.com/485. I hope that you enjoyed today's episode with Samantha. It was such a nice opportunity to connect with her and also to talk about her experience, to go a little bit deeper into her experience overcoming period pain. And I feel like a really interesting and rich discussion came out of it. Just really diving into what we consider normal and how the messaging should be around period pain. I think that was really important to talk about because, obviously period pain is extremely common with a fairly significant percentage of women who do experience period pain. If I remember correctly, it's something like 50 to 60%, of women experience it. And I think that it is important from the standpoint of using the menstrual cycle as a vital sign and diagnostic to be quite clear on how we should be looking at period pain. And it is a bit controversial, and not all practitioners necessarily agree on the definition. But the way I approach it is that although it's very common for women to experience period pain, moderate to severe pain that requires use of medication, I feel like we can acknowledge how common it is and how such a large percentage of women do experience that with their periods, while also recognizing that pain with periods, painful menstruation, that's enough that requires you to use medication, moderate to severe, is actually not optimal. And it is a sign of increased inflammation and potentially a sign of a more serious issue like endometriosis or other types of pelvic issues. With that said, I don't think it's particularly useful to present the idea that there's this ideal that all women should be driven to reach, where they'll never feel anything ever again and they'll just have periods and feel absolutely nothing, because that's not a realistic goal for some women, especially for women whose pain is severe, who may have endometriosis or another condition that would be contributing to their pain. Because although it is possible to get to the point where your periods are either pain-free or in that minimum to moderate, quite manageable phase, I feel like what we should be doing is not comparing ourselves to other women, but we should be comparing ourselves to ourselves. And so I've never had a client who was able to bring down their pain. So whether they rated their pain at a 9 and they brought it down to a 6 or a 5, or whether they rated their pain at a 5 and it came down to like a 2, I've never had a client in that scenario who wasn't thrilled that they were able to reduce their pain. And so from that perspective of practitioner supporting client to improve period pain, I'm always comparing my client to my client. I'm always looking for improvements and reduction based on their symptoms. And having that be the goal as opposed to everyone needs to have zero pain, I feel like it makes more sense. And we talked in this episode about some of the reasons why that is. But this is a process any woman who's experienced moderate to severe pain for years essentially with their periods will recognize that this is a chronic issue, and it's really unfortunate. It's not fair, it's not fair that some of us have to deal with this chronic pain and we have to kind of manage it, and others just don't have any pain with their periods. Of course, we can say that about anything. It's not fair that some women have PCOS, or it's not fair that some women have thyroid issues, but at the end of the day, this is often the cards that we're dealt with. And again, looking at the menstrual cycle as a vital sign and diagnostic and being able to track our progress, I feel is a much more useful way to spend our time as opposed to looking to this ideal. So I'm really glad that Samantha brought up that topic and we were able to dive deep into it. So I hope that you enjoyed today's episode. I hope you have a wonderful weekend whenever you're tuning into the show. And of course, as always, until next time, be well and happy charting. And that's a wrap. If you're loving the FAMM Practitioner series, then I know you'll love our Fertility Awareness Mastery Mentorship Program. It's a 9-month immersive experience that will completely transform the way you work with clients, allowing you to not only teach fertility awareness to your clients, but to use the menstrual cycle as a vital sign and diagnostic tool in your women's health practice. Our next class starts on October 4th, so there's still time to reserve your spot. Apply now at fertilityfriday.com/FAMMlive, and when you apply, you'll have the opportunity to join one of our upcoming information sessions for additional details. There are no other programs like this offered anywhere. Transform your practice in 9 months. Head over to fertilityfriday.com/FAMMlive to apply now. That's fertilityfriday.com/FAMMlive.